The scene is safe. Hi, my name is Rebecca. I'm going to be a nurse today. What's your name?
Hi, I'm Selena.
And what is your birthday?
9/24/87.
Awesome. What's the date today?
4/17/2013.
Good. And where are you at?
SAU.
Good. Patient is alert and oriented ×3. Her gait is even and her balance seems to be intact. She is not using any assistive devices. There's no involuntary movements or no obvious deformities. Her posture is erect and relaxed. Her face is relaxed, just a little bit tired, but she has a pleasant affect and is cooperative. Her speech is intact, clear, enunciated, speaking English, and her hearing appears to be intact as well. Her nutritional status is appropriate for age and stature. She appears to be stated age. Cleanliness appears to be not an issue. She has good hygiene and her hair looks clean. There's no obvious odors. I'm going to look at your nails right now. They are clean and no lumps or bruises or marks on her nails. They look good. Thank you. Now I'm going to be looking through your hair. Hope you don't mind. Okay. Her hair is clean. It's not brittle and it is no receding hairline. It looks very healthy. Now I'm going to be feeling your scalp. Her sutures are all intact, well put together. There are no lumps or lesions on her head. Looks very healthy. Awesome. Alright, you can put your hair up if you want. I'll be looking at your face. The skin all over her body appears to be olive and equal all over the body and healthy. Her facial skin is equal to the rest of her body, and her eyebrows are there, and they also raise symmetrically, so that's good. I'm going to be testing sensations on your face, so I'd like you to please tell me what you feel and how it feels to you. Over, close your eyes, please. Tell me if it feels equal all over your face. Okay, what did you feel?
Soft.
Okay, good. Cranial nerve 5 is intact. She's able to sense stuff. And now I'll be feeling her temporal pulses. They are strong, +2, equal bilaterally. I'm going to be feeling your sinuses, so tell me if there's any pain. Is there any pain for your sinuses? Very good. They're intact. So now I would like you to smile for me, please. Awesome. Give me a frown. Good. And raise one eyebrow. Oh, good. Okay, well, your cranial nerve 7 is intact. You're able to make facial expressions. Okay, now we're going to be looking at your eyes. So I'm going to get this here. Your sclera is white. I see a few blood vessels. There's no exudate in her eyes. I'm going to pull your eyelids down here a little bit. And conjunctiva is transparent and moist, and your irises are blue, flat, and round. Your eyes are clear. There's no cloudiness, and your pupils are round. And then look at the box for me. They dilate. Now look at my finger, and they constrict, so they're accommodating. And when they shine this light in your eyes so fast, they constrict, so they are accommodating to light. That is really good. Okay. Now I'm going to be shining this in your eyes, so look up at the box for me. Red reflex noted. Now I'm just looking for a blood vessel, and I found one. Now I'll be following it to the optic disc. Very good. There's a nice clump of healthy blood vessels, and your retinal background is a peachy color. It looks healthy. No macula noted. Found the optic disc. Very good. Now we're going to be doing a few tests for your eyes. So first we're going to do a cover test. So I'd like you to take your hand and just cover one of your eyes. Take it away. And now cover the other eye. Take it away. There's no deviation of the eyes. They appear to be equal and strong muscles. And now we're going to do a peripheral test. So cover one of your eyes, please. Good. Now tell me when you see my fingers.
No. No. No.
Very good. Now the other eye.
No. No. No.
Great. You have good peripheral vision. Now we're going to be testing your cranial nerves. We already tested cranial nerve 2 in class, and you were able to read the Snellen chart well. And so now, if you'll follow my finger, cranial nerve 3 is intact, cranial nerve 6 is intact, cranial nerve 4 is intact. Awesome. Thank you very much. Now we're going to be looking at your ears. Do you feel any tenderness in your ears? Very good. Alright, so now, maybe if I come on this side, it'll be easier to see. So, there's no exudate coming from your ears. The skin appears to be equal on the ears and is warm to the touch. Her face is also warm to the touch and not moist. Very good. So now I'll be pulling your ear back, up and back. Oh, it would help if I turned on the light. There's a little bit of wax noted, and the rest of it is clear. The cone of light is noted at 7, and the tympanic membrane is pearly gray color, and the other structures are noted. Very good. Now we're going to be doing what's called a whisper test to test your cranial nerve 8. So what I would like you to do is just kind of take your hand and push gently on your ear, and I will be whispering some numbers to you, and so just say them out loud to me.
Okay. 7, 2, 3.
Very good. Now the other ear.
5,
9,
9,
3.
3.
Very good. Cranial nerve 8 is intact. And now we're looking at your nose, and there's no obvious deformities on the nose. Is there any tenderness on your nose? Very good. Your skin is warm. It's not moist. It's evenly colored with the rest of your face, and the bridge is not out of line. And so I'm going to be looking up your nose, and it might tickle a little bit. Just try to relax. Okay. It is very nice looking in there. It's pink, no exudate noted. It's moist. I see a couple of turbinates with no lesions or masses, and they are also moist and pink, not swollen. And your other nostril, it is pink, couple turbinates noted, no exudate, they're moist and not swollen. Sorry about that. Also, to test the patency of your nose, I would like you to please cover one of your nostrils and sniff. Very good. The other one, sniff. Very good. Your nostrils are patent. Can you please close your eyes for me? Now tell me what this smells like.
Alcohol.
That is correct. It is an alcohol swab. Your cranial nerve 1 is intact. You are able to smell. Very good. Alrighty. Now we're going to be looking at your mouth. So your lips are not cracked. There's no lesions. They are pink. Very good. Can you open your mouth for me and just kind of show me your teeth? Very good. They're white. There's no obvious cavities in the front. No food. The gums look healthy. Okay. Now if you will open your mouth for me, please. And we're looking around to see if there's any lesions or anything out of the ordinary. There's no lesions, masses, or any kind of breaks. Your frenula is intact and your tongue is very pink and moist. Your whole mouth is moist. Now say ah for me.
Ah.
Very good. Your uvula is in line and not swollen. Can you stick your tongue out for me? Very good. Your tonsils are +1. And I'm going to check your gag reflex, which is not fun. Very good. Your gag reflex, cranial nerve 10 is intact. Very good. Alright, now I'm going to look at your soft and hard palate, so just open your mouth once more for me. The soft palate is connected to the hard palate, and they are both moist and pink with blood vessels noted. Hard palate has rugae on it. And now we will be looking at your tongue. Just going to put my glove on here. Stick your tongue out for me, please. Very good. There's no lesions or masses or any issues. It's soft. Appears to have good strength. Now can you stick your tongue out on both of your cheeks, move it around. Cranial nerve 12 is intact. Very good. That's awesome. Alright, now we're going to check your lymph nodes. So I'm just going to be feeling to see if I feel any of them. This is where your preauricular lymph node is. It's non-palpable. Postauricular node, non-palpable. Your occipital node are non-palpable. Jugular digastric node, non-palpable. Submandibular nodes, non-palpable. Submental node, non-palpable. Superficial cervical node, non-palpable. Deep cervical chain, non-palpable. Supraclavicular node. There's a couple here that are very small, round, with no lumps on the side of them or anything like that. And your posterior cervical node, non-palpable. Very good. Now, your epitrochlear nodes are non-palpable, bilaterally non-palpable. And now I'm going to ask you to just kind of chew right here. You're going to be testing your temporomandibular joint, and now open your jaw up and down. Very good. And now just kind of put your jaw from side to side, stick it out. It has a good range of motion. Your muscles are strong and no cactus is found. Your trachea is in line. There's no lumps or lesions noted. Now we're going to be feeling for your thyroid. So I would like you to look down at the ground for me. You can choose either side, just a little farther. All right, now swallow for me. Very good. Now the other side. Swallow. Very good. Your cranial nerve 9 is intact because you're able to swallow, and your thyroid is slightly palpable with no masses or any lumps on it. It rises with your swallowing. All right, now we're going to feel your carotid pulse. Very good. Both sides are strong and equal. They feel the same on both sides. They are about a +2. Now I'm going to be listening for breaths in your carotid. I did not feel any thrills on your carotid, so that's good. No thrills. Very good. You have a healthy carotid. Now we're going to test your cranial nerve 11, so please raise your shoulders. Very good. It's equal bilaterally. Now push your face against my hand on the other side. Very good. Now for your cranial nerve 11 is intact and strength is equal bilaterally. And now for some range of motion to your head, do what I do. Very good. Now for your head all the way around. Awesome. You have a very good range of motion for your neck. All right, and now we're going to look at your arms. The skin is olive colored. It is equal to the rest of the body. There's no lesions or masses noted. It's moist. It's not moist. It's warm to the touch. And cap refill on the fingers are under 2 seconds, which is good. And the turner on both hands is elastic. You don't seem to be dehydrated, which is very good. Now we're going to do some range of motion for your arms. Arms behind you, out in front of you, up, back behind you, and back behind your back. Very good. You have total range of motion in your arms. Now for some strength exercises, put your arms up like this. Now push up against me, push down. Very good. Now fold your arms like this. Good. And very good. You have great strength in your arms. Now put your fingers like this for me and don't let me break them. Very good. Now put your hands like this. We're going to test the strength in your wrist. Don't let me break it. Very good. Now, put your hands like this. We're going to test the strength of your fingers. Don't let me break. Awesome. You have great strength, and it's equal bilaterally for your arms, wrists, and your hands. Now, squeeze my fingers as tight as you can. Testing the strength equally, and it is equal bilaterally. Very good. Now we're going to test your reflexes on your arm. We're going to test your triceps. And so just let it fall loosely, and if you want to, you can grab your knee with your other hand and think about a beach. Close your eyes and just squeeze your knee and let this arm loose. Very good. I saw a slight movement in the fingers, which means that your reflex is about a +1 for your tricep. Now we're going to do your biceps and just relax and think about a beach. I'm going to see if we see any slight movements in your fingers. Yeah, it's about a +2 for your biceps. Very good. Now we're going to do your brachioradialis, which is right here, and we're going to test the reflex. Relax your arm. Very good. That's about a +1 for your brachioradialis as well. Now we're going to be testing the pulses on your brachial artery. Very good. It's about a +2 and equal bilaterally. It has good strength and rhythm. We're going to do your anticubicals. It's a +2 on both sides as well. And it's got an equal rhythm on both sides, and it is very strong. And your radial pulse, that is a strong +2 as well, and equal bilaterally with its rhythm. Very good. Now we're going to do some sensation tests on your hands to test your nervous system. So if you'll just close your eyes and tell me what you feel. Is it hot or is it warm or is it cold?
Cold.
Okay.
Warm.
Good.
Cold. Warm. Okay.
Very good. You have excellent temperature sensations. Now for some sharp or dull. Tell me if you feel sharp or dull.
Sharp. Dull. Dull.
Sharp. Sharp.
Dull.
Very good. The pain sensations are good as well. Now we're going to be testing your parietal lobe by placing something in your hand, and if you can tell me what it is, then that is a very good thing. So tell me what this is.
Key.
Great. And tell me what this is.
Paperclip.
Very good. Parietal lobe is intact. Now I'm going to draw something in your. I'm going to draw something in your hand, and I'd like you to tell me what it is.
0?
Yes, these are numbers.
Okay. I didn't get that one.
I'm sorry.
A 3.
Very good.
A 7.
All right. We're going to do this hand.
8. 1, 0.
Okay, you are able to tell what it is equally bilaterally, and so now we're going to also test. I just like to just see the range of motion for your fingers. So just stick your hands out like this. Very good. Make a bowl. Awesome. You feel excellent range of motions for your fingers. Now we're going to test positioning. So close your eyes. I'd like you to tell me if your fingers are up or down.
Okay.
If I can get the fingers straight.
Down.
Very good. Your wrist.
Up. Up.
Very good.
Down.
And what's your arm doing?
It's up.
Awesome. You have good positioning sense. All right, now we're going to be moving on to your chest, and I'm going to move around to the back. And I'm going to have you tell me 99 every time I put my hand on your chest.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Great. Slight vibrations are felt in every lobe. Did you feel any tenderness when I was touching you? Awesome. There's no lumps or masses noted in your posterior chest, and your breathing is unlabored and symmetrical. Your ribs are sloping downward. And so now we're going to listen to your lungs. So every time I touch my stethoscope to you, please take a good sized breath. Very good. No advantageous sounds. It sounds very clear in all your lobes. So now we're going to do a percussion test to see how resonant your lungs are. We'll only have to do it on one side. So just sit back. In the areas where your lungs are, there's a good resonance. Now we're going to be testing for your lung expansion. So I'm going to be pulling up your shirt. All right. Take a deep breath for me as big as you can. Very good. Okay, your lung expansion was about 3 centimeters. And now if you would take a large breath for me and hold it. Okay, let that breath out. Take a few deep or normal breaths, and then I'm going to ask you to let it all out. And then hold it. Very good. You have a lung expansion of about 3 centimeters. Very good. And your skin is equal to the rest of your body and an olive color, moist, and turgor is elastic. Very good. Now we are going to be doing the same thing on the anterior part of your chest. And I'll be, say 99 please, every time I touch you.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Vibrations are felt equally in all your lobes. Over the breast tissue, we'll skip a little bit because it is harder to distinguish clear sounds and vibrations over the breast tissue. We also are not going to be doing any assessment of the breast because we already did that in class, as well as doing the vital signs in class. So we're not doing that at this time. And so take a deep breath for me. Clear lung fields anterior and posteriorly, and no adventitious sounds found anywhere. Now we're going to do some percussion to see how the resonance of your chest is. Okay. Resonance found in all your lung fields. Now we're going to be listening to your heart. So sit tight, and we're going to be looking for any murmurs and extra heartbeats. Your heart rate is about 62 beats per minute, and it has a rhythmic, clear sound with no extra sounds noted or murmurs. Have you ever had any in the past? Very good. I'm glad of that. And there's no pulsations noted on her chest from her heartbeat, and it sounds to be very good. So if you'll lay down on the bed for me, we're going to assess your abdomen. So if you'll just, thank you. We're going to be inspecting the skin of your abdomen. Is warm to the touch, it's not moist, and turgor is elastic. Carotid pulsations noted. Her umbilicus is in line. There's no obvious deformities, and the skin coloring matches the rest of her body, and her apical impulse is not noted. Now we're going to be listening to your bowel sounds and to your aorta. Your aorta pulse is noted on your abdomen. Vowel sounds are active in all 4 quadrants. I'll be listening to your aorta. I don't hear any bruits from your aorta. Now we're going to be feeling for the size of it. It's about 3 centimeters long as well. Now I'm going to be doing light touch on your abdomen. Tell me if you feel any tenderness or any pain. I'm looking for masses, just to see if anything's out of place. You feel any pain? Awesome. Alright, no masses noted. Now we're going to do a deeper palpation. Before we do that, I would like to know if you had a chance to go to the bathroom. Very good, because that would be uncomfortable if you hadn't. So we're feeling for any masses and just feeling to see if we can tell the organs in her abdomen. Take a deep breath for me and let it out. Spleen is non-palpable. Small mass from kidney noted on left side. Kidney noted on right side, not swollen. Now we're going to be finding where your liver is. Alright, your liver diameter is about 8 centimeters. Now we're going to be feeling for the edge of it, so take a deep breath and let it out. We're just following the muscles in to feel for her liver. Now take a deep breath again and let it out. Very good. The edge of the liver is palpable, no masses or any irregularities noted. Now we're going to be percussing for the spleen. Okay, the spleen is not swollen. It is under 7 centimeters. Now we're going to be testing the reflex of your abdomen, so just relax and close your eyes. Very good. Slight wave noted from both sides of your abdomen reflexes. At this time, we would do your inguinal nodes and your femoral pulse, but the patient is uncomfortable with that. And so now I would like to have you raise up onto your arms for me, please. I'm going to be looking at your jugular vein and just seeing if we see any pulsations or if we need to measure for the pressure of it. A very slight pulsation noted from her jugular vein. It is not distended or swollen on either side, so we do not have to do the pressure of it, the test on it. So now if you can sit up for me, that would be awesome. Okay, now I would like you to lay down for me one more time. I am going to percuss your abdomen real quickly. We want to look for timpani sounds from your abdomen. Okay, so it has some timpani sounds, not all the way around. Probably have some food in there that's digesting. So if you'll sit up for me, I'm going to go around to the back and just give your kidneys a little pop on the back. Now tell me if there's any tenderness with that, please. Did you feel any tenderness on either side?
Oh.
Very good. Alright, now we'll be looking at your legs. And so the skin on your legs is equal. There's a few scars noted. It is warm to the touch. It is not moist. Very good. Your it is within 2 seconds. Okay, we'll come back to that. We're going to test the strength of your legs, so please push up against my hands. Now push down against my hands. Very good. Now push against my hands. Pull against my hands. Very good. Push down against my hands and up. Your strength is equal bilaterally for your legs and your feet, which is very good. Now can you spread your toes for me? Very good. Now move your feet all the way around so your feet and toes have good range of motion. Now we're going to be doing sensations, so if you'll close your eyes. Tell me if it is sharp or dull.
Sharp. Dull. 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 Sharp. Dull.
Very good. Now we're going to be doing temperature. Is your pain sensations are intact? Is this cold or warm?
Cold.
Very good.
Warm. Warm. Cold. Woohoo, cold.
Temperature sensations are intact as well. And now we're going to be testing your reflexes. So just take your hands like this and pull them tightly together and relax when I tell you to. This is your patellar reflex. Relax for me. Very good. Now pull your hands tight.
I have a hard time relaxing.
Yeah, your legs are very stiff. Think of a beach.
Come.
I saw a slight twitch in your foot. I'm gonna give your patellar reflexes a +1. And now your Achilles reflexes. Push the foot up and give it a slight tap. Very good. You have a +2 in your Achilles tendons. Now we're gonna do the Babinski reflex, which is your favorite. We're gonna move back. Just relax. Close your eyes. Very good. Your toes curved inwards. You have a negative Babinski reflex. Now we're gonna feel for your pulses and your popliteal pulses. These are not always felt in adults. I can feel them slightly, so I give them a +1. And now we're going to do your tibial pulses. They are strong and equal bilaterally, and I give them a +2. And so for your dorsal pedalis pulses, they are also strong. Just gonna see if I can get them both. My fingers. Very good. They have a +2. They are equal bilaterally and good strength. So, very good. Now I'm going to have you stand up for me. We're going to do the Romberg test and pronator drift all in one. So if you'll stand up for me. And close your eyes and put your hands out in front of you. And now put your palms facing upwards. Very good. You have excellent balance. And now as you're standing here, I'm just going to feel your legs. The hair distribution, patient states shaving her legs, so we can't tell that, but there is no edema in the lower extremities. And now I'd like you to please do what I do. We're going to test the range of motion for your spine. So, backwards. And now lean forward from me because I'm going to be testing your spine and just looking at it. Can you touch your toes? Very good. Now, I'm walking up your spine and I can tell that it is straight. I don't feel any abnormalities. And do you feel any tenderness while I'm walking up your spine? Very good. Now, I would like to have you please walk over to the door for me. We're going to be testing your gait and your balance. Now, if you'll walk with your toes in front of, heel to toe, all the way like 10 steps for me, please. Balance is equal and very strong, no abnormalities at all. Now I would like you to walk to the door on your heels, please. Very good. Now if you'll walk on your toes all the way like 10 spaces. Very good. You have excellent balance and your gait is equal and smooth. Now if you'll take a seat again. Now we're going to test your cerebellum. I would like you to touch your nose and then touch my fingers. Very good. Keep doing that. Your cerebellum is intact for your fingers. Now take your heel and just kind of slide it down your shin for me. Thank you. Your cerebellum is intact for your feet, and you are able to do that correctly with no deviation of the feet. Okay, now I would like for you to close your eyes, and I'm going to be doing positioning on your feet, and tell me if your toes are up or down.
Up.
Very good. Is your foot up or down?
Up.
Very good. Up or down?
Down. Up.
Very good. Now we're going to do the range of motion for your body, so if you'll stand up for me. Now squat for me. You have excellent range of motion and muscle strength in your lower body. And your hips also had excellent range of motion when you did the side to side. So I want to thank you very much for being an excellent patient. You are very healthy.
Oh, thank you, and you're a wonderful nurse.
Have a good day.
Thank you, you too.